So we will start talking about the arthrosyndesmology. As I told you, arthrosyndesmology is a study about the bones articulations. I'd like to remind you the skeleton is the complex of the bones which form the heart framework of the human body. And maybe you remember during our first class about the locomotor system, I mentioned the functions which could be subdivided into two main parts: the mechanical functions and biological. Mechanical as the supporting, locomotor and protective function, and biological as the mineral metabolism, hemopoietic function, and immune function or protective function. If we're talking about the development of the bones, you have to know it develops from the mesenchyme, and first, if we're talking about the articulations formation or joint formations, at the place of the future joint, the aggregation of the mesodermal cells occur, and then it gives rise to the articular cartilages, and then gradually in this place the future articular cavity will be formed. If we're talking about the classification of joints, you have to remember about three main types of the joints. First, known as the uninterrupted, second type interrupted, and in between these two is the hemi-interrupted type. And the next row shows you the synonyms for that. So for uninterrupted, also known as synarthrosis, it's a Latin term. For interrupted, synonym is diarthrosis, and for hemi-interrupted, hemiarthrosis or symphysis. Also in different textbooks you can find another synonyms like the fibrous joints, cartilaginous joints, and also synovial joints. All these are the synonyms for mentioned above types. So let's start with the uninterrupted articulations. Uninterrupted, also known as the continuous articulations. What does it mean? It means the space in between two or more bones is filled by some tissue. And depending to this tissue, we can distinguish following types: syndesmosis, made up by the dense connective tissue; synchondrosis, made up by the cartilaginous tissue; and synostosis, made up by the bony tissue. I hope you remember Latin term os, it means bone, that's why synostosis formed by the bony tissue. So syndesmosis. Syndesmosis are represented by the following most common types: ligaments, membranes, sutures, fontanelles, and gomphoses. Most common of all these are two: ligaments and membranes, which are present anywhere in the human body. The sutures, fontanelles, and gomphoses are the types which are present just in the region of the head. So ligaments. Ligaments are represented by the quite long bundles of connective tissue stretching in between the bones. As the example, your previous class, remember we were talking about the shoulder girdle bones, pelvic girdle bones, and you remember pelvic girdle is formed by the main sacrum and hip bone, and in between the sacrum and hip bone we can see very nice developed ligaments like the sacrospinous ligament from the sacrum to the ischial tuberosity and sacrotuberous ligament from the sacrum to the ischial tuberosity. Next, membranes. Quite similar to the ligaments, but remember I told you ligaments are the long bundles of connective tissue, but these membranes is also made up by the connective tissue, but it fills some space, some area. As the example again of our today's class, obturator membrane which completes the obturator foramen, or antebrachial interosseous membrane which completes the space in between the ulna and radius. And if we're talking about the today's class, membrana interossea cruris is the interosseous membrane of the lower leg which stretches in between the interosseous borders of the fibula and tibia. Next type, sutures. Sutures present, as I told you before, just between the bones of the head, and depending to the shape of these sutures they are classified into the serrate sutures, sutura serrata, squamous sutures, sutura squamosa, and plain sutures, sutura plana. And as you can see here, these serrate sutures mostly present in the region of the skull cap or vault of the skull, and formed by the tooth-like projections of one bone inserted in between the tooth-like projections of another bone. But you have to remember, sutures are the types of syndesmosis. That's why these tooth-like projections are fused by means of the dense connective tissue. Next type of suture is a sutura squamosa, squamous suture. Squamous suture, squama, Latin term squama, is translated as a scale, like the fish's scale. What does it mean, squamous suture? It means the oblique border of one bone overlaps oblique border of another bone. For example, this squamous suture formed by the squamous part of the temporal bone which overlaps squamous border of the parietal bone. And plain sutures. These sutures present in between the bones of the facial skull, where quite flat border of one bone articulates with a flat border of another bone, but I'm reminding you again by means of connective tissue. Next type are the fontanelles, also between the bones of the skull, and this the type of syndesmosis present just in the newborn. It is the result of incomplete ossification of the skull bones, and it is necessary for normal birth process. For example, here you can see unpaired anterior and posterior fontanelles. Anterior is diamond shaped and formed in between the frontal and parietal bones, and posterior fontanelle is triangular shaped sorry, and formed in between the parietal and occipital bones. Two more fontanelles are paired right and left, and they are the anterior lateral or sphenoid fontanelle and posterior lateral or mastoid fontanelle. These two quite often are closed in embryonic life before the childbirth. One more type of articulation which is present just in the region of the head, known as the gymphosis, It is specific type which is formed between the roots of the teeth and also dental alveoli. Next types of continuous articulation is represented by the synchondrosis. Synchondrosis means continuous articulation made up by the cartilaginous tissue. So, depending to the histological type of this cartilage, all synchondroses are classified to the hyaline synchondrosis and fibrous synchondrosis. Depending to the time of duration, to the permanent and temporary. Hyaline synchondroses are made by the special type of the hyaline cartilage. Its whitish shiny cartilage may be well known for you. If you were eating the chicken, you saw these shiny white cartilages covering the bones. And such type, for example, present in between the first rib and manubrium sterni. Fibrous type of synchondrosis is made up by the fibrous cartilage and present, for example, in between the vertebrae. These fibrous synchondrosis form the intervertebral disc. Depending to the time of duration, synchondroses are classified into the permanent and temporary. Permanent, present throughout the life, from the delivery till the death. As the example, again between the first rib and sternum, it is permanent synchondrosis. Temporary synchondrosis present just during some period of the life. Again, our today's class, remember we were talking about the hip bone and three bones matched together: ilium, ischium, and pubic bones. So it is the example of temporary synchondrosis because after the puberty this synchondrosis will transform to another type of articulation, which is the synostosis. Synostosis also can be subdivided into two groups: the synostosis at the place of synchondrosis and synostosis at the place of syndesmosis. Next type, most movable type of articulations, known as the true joints or synovial joints. These synovial joints have obligatory elements, and you have to know these obligatory elements. Obligatory elements of synovial joints are represented first by the articular surfaces. Articular surfaces means the bones participating in this or that joint formation covered by the articular cartilage. Second obligatory element of synovial joint is represented by the articular capsule. Articular capsule is attached to the bones and encloses third element of obligatory element of synovial joint, articular cavity. Fourth element of synovial joint is synovial fluid, which is produced by the synovial membrane of articular capsule. It's the property of synovial membrane to produce the synovial fluid and also at the same time absorb it. And between these two processes, production and absorption, the balance is kept. It is necessary to take the constant volume of synovial joint inside of the synovial fluid inside of the joint. This synovial fluid is necessary first for lubrication of the articular surfaces and easy gliding of these articular surfaces, and also it is necessary for nutrition of articular cartilages because articular cartilages are avascular structures. And this chart shows you the obligatory and auxiliary elements of synovial joint. As I mentioned above, obligatory elements are the articular surfaces, articular capsule, articular cavity, and synovial fluid. All another elements known as the auxiliary elements and represented by the ligaments, disc, menisc, articular lips, synovial bursa, plica, recess, and so on. What does it mean? It means when you will describe any joint, you have to find these obligatory elements. If you will not able to find even one of four obligatory elements, it means it is not synovial joint. It is some another type articulation, but it is not synovial joint. But auxiliary elements are non-obligatory and could be present or absent. Classification of synovial joint according to the structure. According to the structure, synovial joint can be represented by the simple joint, compound joint, complex joint, and combined joint. These four main types. What does it mean, simple joint? Simple joint, it means the joint having just two articular surfaces. As the example you see here, interphalangeal joints, where base of one phalanx articulates with the head of another phalanx. Next type, compound joint. Compound joint is formed by more than two articular surfaces. Example you can see here, elbow joint where three bones participate, that's why it has more than two articular surfaces. That's why it is compound. Pay your attention. It is impossible that join simple and compound at the same time. These two vice versa in classification, or simple or compound and nothing else. Next type, complex joint. Complex joint, by the way, here's mistake, here should be knee joint but not the hip joint. Complex joint means the joint which is formed not only by the articular surfaces but also some articular disc or menisc present inside. It's the layer of the cartilage in between the articulating surfaces. These interarticular structures help to make the articular surfaces more congruent to each other. Congruent means correspond to each other. For example, like this picture, you can see spherical shape of the head of the femur and concave, deep concave acetabulum. They are congruent to each other. Next type in classification, combined joint. Combined means two or more anatomically isolated joints which cannot act without each other. And you can see here a classic example. It is a temporomandibular joint. You can try many times to open your mouth using just one side temporomandibular joint, but it is impossible. Even slight movement in one joint will cause to the movement in another joint. That's why this type of joint is compound. So according to the structure, simple, compound, complex, and combined. Pay your attention. Joint can be simple, at the same time it could be complex and combined, but never been simple and compound at the same time. According to the functions, all joints classified to uniaxial, biaxial, and multiaxial. It depends to the movements permitted by these joints. And now the knowledge is about the axis, maybe you remember our first class, will be very useful for you. Uniaxial, it means permit the movement just around one axis, and for example it permits just one type of movements, flexion and extension. Biaxial permits the movements around two axes, for example it permits flexion and extension and adduction and abduction. And multiaxial permits the movements around all three axes. And here you can see the examples of movements. Around the frontal axis it is flexion and extension. Around sagittal axis it is adduction and abduction. And around vertical axis it is rotation, which is also represented by two types, by the pronation and supination. Next classification is according to the shape of articulating surfaces. So uniaxial joints can be represented by the hinge joint and pivot joints. These are the main types of uniaxial joints. Biaxial joints can be represented by the condyloid type of joints, ellipsoid type of joints, and saddle type of joint. So biaxial, I will remember you, permits the movements around two axes. And very interesting in this case is the saddle type of joint, which is present, for example, in the first carpometacarpal joint. Why is it interesting? Because usually articulating surfaces are corresponding to each other, and for example in the condyloid or ellipsoid type, one articulating surface is concave and another is convex. But in the saddle type joint, both articulating surfaces are concave, like the saddle on horse. One concave articulates with another concave and by this way permits the movements around two axes. And multiaxial type of joint represented most often by the ball and socket. If one articular surface is spherical ball and another is concave socket, yeah. For example, well known for you shoulder joint, we were talking about that last time, and for example hip joint material of our today's class. One more interesting type of multiaxial joint is represented by the plane joint. Such plane joint permits very small range of movement usually. For example, in between the articular processes of the vertebrae. Superior articular articulates with the inferior articular process. Why is it included in the multiaxial joint? Because, for example, if you are looking to the Earth's surface, you also can see it as a flat. But really, we all know the Earth is not flat, it is spherical. But we can see just some very small part of this big sphere. Same, this plane joint is multiaxial because we can imagine that look to the one small part of the very big sphere. And next very important thing, please, you all have to remember this plan of the joints description. You will use it to prepare for practical classes, and during the practical classes and same during the exam, you have to answer according to this plan. According to this plan. And first in this plan is the name of joint, means in Latin and in English. Then articulating surfaces, you have to name the bones participating in this joint formation. Articular capsule and its attachment. It means you have to describe how is articular capsule attached, and here I can tell you about some secret information. In 98% of cases, you will absolutely right if will tell the articular capsule is attached along the borders of articular surfaces. And just sometimes you have to tell about some details. After that, you have to characterize the auxiliary elements. Remember, in the classification I told you this could be some ligaments, some interarticular disc, menisc, lips, and so on. Then, type of the joint according to the structure: simple, compound, complex, or combined. According to the functions: uniaxial, multiaxial, biaxial, and according to the shape of articular surfaces. Next, if you told it is uniaxial, you have to tell what is the axis and what movements around the axis it permits. For example, flexion and extension around the frontal axis, or maybe it is biaxial, flexion and extension around the frontal, and abduction and abduction around the sagittal axis. Then we'll describe some anatomical features, especially about this or that joint. And also you have to tell, you will not tell now, but during the exam, after the course of anatomy, after we'll finish cardiovascular system, we're talking about the blood supply, venous lymphatic drainage, and innervation of the joint. Now this last point is not necessary to memorize and not necessary to study, because you will not study this material yet.